Assalamualaikum doctors. In this video I am discussing a very famous topic, that is Down syndrome. Normally Down syndrome history. Down syndrome with hypothyroidism is a common come on the history, and also it comes on development, communications, video station everywhere. So Down syndrome look the child features, that is upward slanting of eye. The tongue is very big tongue, that is macroglossia, and also there is depressed nasal bridge. So Down syndrome, the chief complaints is like that. Fahad is an 8 years old boy with Down, came with his mom Ora for annual follow-up. So Down syndrome patient come with follow-up. The history of present illness concern, the child had not interested in height for 2 years. Increased in height. The child had not increased in height for 2 years. How did you notice that? Any growth chart with you? Down syndrome special chart. What about mom height? Dad height? If known to the mother. Before this time, was he increasing in height normally? So we will ask that follow up, what is the problem? Last 2 years he is not increasing weight. So we like, how did you notice that? Any growth chart with you about Down syndrome special chart? What about the mother height and the father height? If known to mother, then before this time was he increasing in height normally? Then general FWSL, fever, weight loss or gain. Remember, weight gain is features of hypothyroidism. So FWASL, fever, weight gain or loss, appetite, sleep disturbance, increased sleepiness, mood, emotional disturbance. So increased sleepiness and weight gain, features of hypothyroidism. Now any chronic disease like celiac or diabetes mellitus, as Down syndrome associated with this disease. Any unusual features, like any unusual features we ask, then mother tell you, yes, a flattened face, especially the bridge of the nose, almond shaped eyes, upward slanting, short neck, small ears, tongue that tends to stick out of the mouth, tiny white spot on his iris, colored part of the eye, small hands and feet, single line across the palm of the hand, that is palmar crease, simian crease. Okay, again, the unusual features of Down syndrome are a flattened face, especially the bridge of the nose, almond-shaped eyes, upward slanting, short neck, small ears, tongue that tends to stick out of the mouth, tiny white spot on his iris, colored part of the eye, small hands and feet, single line across the palm of the hand, palmar crease. Systemic review one by one where you are taking first GIT. Describe his poo. Very important, constipation present in hypothyroidism. Any difficulty of swallowing, throwing up, mouth sore, sores in his back passage area, increase in tummy size, increase in tummy size. It is increase in celiac disease. We know that the standard abdomen. So GIT we are finding constipation, increase tummy size because of celiac associations. Nutrition, we can ask how many meals he is taken. Anorexia present or not. Okay, who prepares food for him? Amount in each meal. Any craving for special type of food? Any growth chart is there. Then CNS, any abnormal behavior, abnormal movement like tremors or chorea. So tremors or chorea like thyroid association or not. Weakness, proximal myopathy present. Headache, morning throw up, numbness, affected vision, double vision, bulging or edema of the eyes. Any concern about hearing, loss of hair of the outer part of the eyebrow. So hypothyroidism feature is that loss of the hair of the outer part of the eyebrow. Any concern about hearing? Okay. CVS, any heart racing, any fainting episode, exercise intolerance. Respiratory about recurrent chest bugs, cough, tolerance of exercise, recurrent ear infections, snoring sound, adenoid facing, sleepiness in the morning. Urinary, any concern about pee, amount, frequency, how many times he goes to bathroom per night, did he measure blood pressure before. So if diabetic association, when urinary ask, pee amount will be increased. Okay. MSK, any skin pigmentation. Because of Addison disease, we can ask any skin pigmentation, hypopigmentation for vitiligo, skin rash, that is erythema nodosum, hair loss in the head or eyebrow. So very important, hair loss in the head and eyebrow, nail joint pain, swelling, any swelling in the legs and feet, that is peritibial myxoedema. Pain on the walking or tingling, that is atlantoaxial subluxation. So they have short neck and atlantoaxial subluxation can be developed. So they have pain on walking or tingling. Now endocrine, any swelling in front of his neck, prefer cold or hot, cold intolerance with hypothyroidism. So endocrine, we need to ask any swelling in front of neck, any cold or hot intolerance, because cold intolerance in hypothyroidism. Hematology, any pallor like anemia of associated celiac or megaloblastic anemia. Okay. So any anemia, pallor, any yellowish discoloration of the skin or eye, any history of blood transfusion, any lump. So hematology we are asking that pain. Okay, then going to past history as usual, 5T IOA, that is like Down syndrome, when he was diagnosed, by whom, how they diagnosed it, what investigation done, what treatment they give, he was given, Is he compliant to the treatment? Which team he is following with hospitalization? How many times in which ward and medications? Then any trauma, traveling history, recent, any blood transfusion, surgery, these are. Perinatal history, mother's age at the time of pregnancy. Remember mother's age. In Down syndrome, we will ask must. Mother age at the time of pregnancy, antenatal scan if done, and its result, any sample or other tests done during pregnancy, any admission to baby unit after birth, any jaundice. Vaccination, allergy, pubertal if relevant. Development in details expected to have a global developmental delay. Family, are you and your husband relative? Describe for me your family. Family history of similar condition or any other autoimmune disease. Psychological, social and home. School or type of the school. School performance, attendance and any bullying at the school. Impact on the family and the child. So this is how we take the Down syndrome history. So Down syndrome can be associated with hypothyroidism. So hypothyroidism features will develop. If it is found with the celiac disease, then we find how. We find that distended abdomen, buttock is wasted, difficult to flush the poo, loose motions. And Down syndrome with if thyroid come, then swelling of the neck, cold intolerance, hypothyroidism, all the features we know there, constipation, weight gain, school performance now deteriorated, weakness, these are. Pale also, Down syndrome associated with leukemia. So this is all about Down syndrome history. Thank you.